Thank you. I'm Stacey Pogue with the Center for Public Policy Priorities here in Austin, testifying for the committee substitute to House Bill 459. I have some testimony that's going around that has some graphics that'll help answer a question Representative Island asked a minute ago, which is how many uninsured people do we have in Texas? And the answer is just over 6.1 million. And when you look at them by their income, most of them are low and moderate income and would qualify under the Affordable Care Act for some sort of financial assistance with coverage, whether that's through the new health insurance marketplace, which is the new term for the exchange, so forgive me if I go back and forth, or through Medicaid. I think this means we have a huge enrollment opportunity under the Affordable Care Act to expand coverage to residents of Texas, but it also means we have a huge enrollment challenge because we need to, in the next several months, reach out to 6 million people in Texas and let them know about this marketplace and the coverage they can get in it. And one important thing I think to remind this committee, because usually how we divide coverage is there's different agencies and different committees that oversee Medicaid and CHIP from the private commercial insurance plans, and those two worlds are brought together in this marketplace or exchange in 2014. If you call or go online or go to a navigator or an agent and go into that marketplace, you're going to be put in a program that's right for you, whether it's Medicaid or whether it's private health insurance with or without subsidies. And one important thing that this Navigator program does is bridge that divide. So Bea Moorhead spoke about the in-person assistance programs we have now that are helping people apply for public benefits. And they help people fill out those applications for assistance, which sometimes can be complicated. And they bring that to the table, but they don't have the private insurance piece background. Agents and brokers have that piece today. They help people understand and enroll in private coverage, but don't have the background on how you fill out applications for assistance, how you count who's in your household or income, for example. Navigators are going to have to bring both halves of that equation together to help people effectively, and we think the need's really big here. 80% of the people who will be enrolled in the marketplace, in the exchange, into private coverage will have subsidies. So we're talking about an outreach program that needs to be able to be targeted to folks that are lower income, less educated, more racially and ethnically diverse, might not speak English at home, that a population that looks differently than who is insured today. And then I'll just point to wrap up on the back. One thing we're interested in as advocates working on this bill is that we don't create barriers to participation in the Navigator program and that we don't duplicate oversight that's happening at the federal level. So we'll have a federal exchange in Texas, and the federal exchange will oversee our Navigator program, including setting standards for conflict of interest, cultural competency. They'll do training. They will require navigators to pass exams and certify them and direct their activities. So one thing that's really important to us in this bill is that the bill authorizes navigators in Texas and state law, and it makes it clear that they can perform their duties, but it doesn't duplicate the work that's going to be happening in the federal exchange. It coordinates instead with the exchange on oversight. And then I just want to wrap up to say that we really appreciate working with Representative Guillen's office on this substitute because we think it does a lot of good things and, again, helps empower navigators without creating additional hurdles. Thank you.